Hello, I'm Kevin Grieme, Director of Health at Siouxland District Health Department. Here just to provide an update on the COVID vaccine and the condition that we have within our community. I think what we really need to take a look at is the concept of moving forward is how do we reduce the impact of our viral diseases? COVID-19 is just like influenza. It's a virus that we learn to live with. The elimination of either viruses is probably not even a possibility. They're both viruses that have a tendency, they change over time. So vaccine will be ever changing. Influenza vaccine is a vaccine that's reviewed each year and updated as needed based upon the most prevalent strains from the previous year. The COVID-19 vaccine has not significantly changed since it was first released, but we have seen a change in the recommendations for number of doses and the intervals for administration of those doses. This will continue as we learn more about the virus. It's just a part of science. Individuals will continue to make decisions for themselves on how they will navigate this landscape that exists. This seems to be creating extreme divides within communities and organizations, which creates other challenges in and of itself. What hasn't changed is that Siouxland District Health Department is going to continue to provide information and education about actions that individuals can take to limit the impact of these diseases on themselves, their families, and to businesses and our community. Healthcare and public health are just as tired and exhausted as everyone else, but we have a commitment to continue to work to minimize this impact. As a collective group, we'll continue to promote the following points for individuals to consider. First off, the good news. Vaccines still work really, really well to prevent severe disease, hospitalization, and death, even if they are less effective against infection and transmission. Vaccines are available for free at multiple locations around the Siouxland community for all individuals that are 5 and older. A second consideration is staying home when you are sick or you're not feeling well. This will help to reduce the existence of all transmissible diseases in our community, much as we saw last year with our influenza cases. Number 3, consider wearing a mask when you are at indoor events, especially when it is a crowd that you are not normally with. For years, we have educated about coughing or sneezing into our sleeve to prevent the spread of colds and influenza. This is just a different version of that. Fourth thing you could do is the consistent message from public health, wash your hands. This is something that has not changed over the course of time, but it has proven to be effective in the spread of mostly all diseases that are there. And then the next part is, if you do begin to feel sick, get tested. And the last point is, remember, as you're moving through this influenza COVID disease season, keep your hands away from your face and avoid touching your eyes, nose, or mouth. These are all preventative measures you can take on an individual basis. None of us like to be sick. This is why it is important that we all make decisions that will reduce the impact of disease has upon us. We have made some great strides over the course of the last 2 years in understanding what we are facing, but we have also been challenged by the many changes we've experienced. As my opening comments alluded to, we are going to have to learn to live with influenza and COVID, but we can take proactive measures to reduce the impact on us as individuals and those around us. What I want you to encourage you to do, this is the first in a series of videos we want to do to provide updates. Future ones will talk about the vaccine testing and other parameters. So for today, thank you for taking this time to join you. And as always, Siouxland District Health Department is to work with and for you to help reduce the impact of disease in our community. Take care.